What is active range of motion? Active range of motion is the amount of joint motion that can be achieved by the patient during the performance of unassisted voluntary joint motion. This evaluates joint range, control, muscle power, and the patient's willingness to perform the movement. What tissues are involved during active ranges of motion? Contractile tissue, nervous tissue, and inert tissue. Prior to performing range of motion movements, we must rule out the joints above and below the joint in question to eliminate their involvement in the patient's clinical presentation. For more information on this, see my video on ruling out. Step-by-step active range of motion assessment. First, we must obtain consent to perform active range of motion assessment. Secondly, you will want to inform your patient to tell you if they feel restriction, pain, or discomfort during active range of motion assessment. Third, you want to rule out the joints above and below the joint in question. Number 4, evaluate active range of motion of uninvolved or unaffected side first or simultaneously if applicable. Fifth, you want to demonstrate and describe the movement to your patient. Then you'll want to ask the patient to perform the movement through the specified range. Next, you'll measure the available range with a goniometer. Then you will record your findings. Remember, the most painful movements should be performed last. What do we observe as an examiner? We are looking for any movements that cause pain or their symptoms. When and where during the movement does the onset of pain occur? Is there any increase in intensity and the quality of pain? What is the patient's reaction to pain? What is the amount of observable restriction and its nature? We'll have a look at the pattern of movement, the rhythm and the quality of movement, and any unusual or trick movements of associated joints. Also, the willingness of the patient to move the body part. In the event of abnormal movements, the examiner must differentiate the cause. They could be due to pain, edema, muscle weakness, paralysis, spasm, tight or shortened tissues, or joint dysfunction. What are some contraindications to active range of motion? Active range of motion should not be assessed if any of the following exist: dislocation or an unhealed fracture, immediately following surgery if motion will interrupt the healing process, if myositis ossificans or ectopic ossification is suspected. The therapist must take extra care when the following is present: if there's any infection or inflammatory process in the joint or in the region around the joint, if the patient is taking any medications for pain or any muscle relaxants, if there's osteoporosis or bone fragility, if the joint is hypermobile or subluxed, or if there are any painful conditions in which active range of motion may aggravate the condition. Some precautions are hemophilia, hematoma, suspected bony ankylosis, immediately following an injury involving disruption of soft tissue, newly united fracture, prolonged immobilization of a part of the body,